Greetings to our assessor. My group will present a case study regarding a 65 years old lady with transient ischemic attack. This is our group member. This is our outline of the presentation. And her chief complaint. Our patient, Madam X, is a 65 years old woman who lives in Kuching, Sarawak. She is a Malay Muslim lady who had been retired since 4 years ago. She had been admitted in Medical Tree SGH on 1st January 2021 through ETD. Before she was sent to ETD, she complained that she had severe headache, feeling weakness on her left side, palpitation, and angina. Next, my friend Harmizi will explain about the health problem of the patient.
For the current medical diagnosis of the patient is transient ischemic attack or TIA. TIA is described as an acute episode of stroke in which it lasts for a few minutes to hours. It is characterized by weakness or numbness. Usually one side of the body will be affected. Secondly is dizziness, and lastly is double vision. For pathophysiology of TIA, the blood to the brain are supplied by two main arteries, which are the internal carotid and vertebral arteries. Due to the build-up of the atherosclerosis at this artery, oxygen and nutrient supply are inadequate to the brain, which means the surrounding nerve cells are also will be lacking of oxygen and affect the body to work. Although the arteries are partially or totally blocked, the blood still can be redistributed by other arteries in the brain, which is by circle of Willis. However, in elderly, the interconnection of circle of Willis are not well structured. Hence, the blood cannot be redistributed effectively as compared to a healthy young person. The patient has numerous underlying medical issues. Firstly is diabetes mellitus type 2. The patient was diagnosed with DM type 2 since few years ago, and the blood sugar level was 9.8 mol per liter during the interview, and taking tablet metformin to control her blood sugar level. Diabetes mellitus type 2 is a condition whereby the body cannot make use of insulin effectively to bring glucose inside the cells. For pathophysiology of DM type 2, it is caused by two factors. Firstly is insulin resistant. It happens when the body cell do not react with the insulin normal effect, which converts glucose to glycogen. As a consequence, glucose starts to accumulate in the blood. However, the pancreas detects the blood sugar level increasing and continuously secreting extra insulin. On the other hand, the insulin production insufficient because the pancreas gets exhausted when too much insulin produced. As a result, the blood sugar is also increased. In elderly, pancreas undergo various pathological changes such as increase of fatty displacement and fibrosis, and this will affect the pancreas to function effectively. Secondly is osteoarthritis. She was diagnosed with osteoarthritis since few years ago. She verbalized the pain score of 5 out of 10 on lower limbs, especially when walking or standing too long. Osteoarthritis is a condition, a long-term chronic disease portrayed by the degradation of the cartilage in joints, which lead to the friction between the bones and cause stiffness, pain, and impaired movement. So how it is happen is normally the end of the bones are covered with protective tissue, which is called as cartilage. However, it can worn out and swelling due to the aging process. This is because the abnormality of the cells to synthesize cartilage components, especially collagen and proteoglycan. So when two bones meet together, this will cause stiffness and pain on the joint. Elderly people are at high risk to have osteoarthritis because the loss of normal bone structure, increased stiffness of the tendons and ligaments, and meniscal degeneration.
The fourth health problem that our patient has is dyslipidemia. It refers to the abnormal levels of one or more types of lipids in the blood. So dyslipidemia can be caused by primary causes, which is genetic, or secondary causes, which are lifestyle and diet. So when a person ages, there will be an increase in the release of free fatty acids from adipocytes and also a decrease in mass of metabolically active tissue and oxidative capacity of tissues, which will lead to the increased probability of an aging person to get dyslipidemia at a later age. Dyslipidemia is closely related to genetic theories and cross-linkage theory in terms of pathophysiology and age-related changes. The next health problem is hypertension. Hypertension occurs when a person has persistent elevated blood pressure exceeding the normal range. So hypertension is closely related to cross-linkage theory. This is the pathophysiology of hypertension, where genetic influences and also environmental factors can cause various changes in the body system that will lead to hypertension. So as a person ages, there will be vascular changes, organ structure changes, for example the heart, and also a decrease in chronotropic, lucidotropic and inotropic responses. The sixth and last health problem that our patient has is angina pectoris. Angina pectoris or stable angina is a chest pain or discomfort that occurs due to myocardial ischemia caused by coronary heart disease. Angina pectoris, its pathophysiology and the age-related changes causing angina pectoris are closely related to the cross-linkage theory as well. So this is the pathophysiology of stable angina. We can see that atherosclerosis, arterial spasm, and also changes to the blood vessels can lead to ischemia, causing hypoxia and increasing oxygen demand, which will lead to stable angina. So as a person ages, their lifestyle, their diet, and their comorbidity will give a large effect on their body system. So next I'm going to talk about the geriatric assessments that we perform on our patients. These are the 4 assessments. The first one is functional assessment. Functional assessments are needed for geriatric patients to detect physical frailty, to gain diagnostic and prognostic information, to identify suitable ways to provide care for the patients, and also to reduce number of specialist visits and to reduce healthcare costs. So we did functional status assessment to detect the physiological changes of the body and to detect how the comorbidity they have affect the functioning of their body parts. So the first one that we did was CATS index. Our patient, for all the criteria here, our patient scored 1 point, which means that our patient is completely independent in carrying out the activities of daily living. The second one is the Losartan instrumental activities of daily living. Our patient has also scored full marks. Has also scored 1 for every criteria here, which proves that our patient is completely independent. The third one is to test mobility and gait, which is the get up and go test. Our patient has also proven a normal and healthy mobility and gait. The fourth one is to test our patient's balance, which is Romberg's maneuver. The result of this maneuver for our patient was negative, which means that our patient has no problem with her balance. So these are the age-related changes that could affect a person's balance. Next is the mini mental state examination, which is to detect any decline in cognitive function. and also to measure orientation, memory, and language functioning. So as a person ages, they have the increased risk to get Alzheimer's disease due to certain factors. So this can lead to the degeneration of brain cells due to aging. This assessment is closely related to Erik Erikson's theory. So for MMSE, our patient recorded perfectly normal scores, which means that our patient has no cognitive impairment. Our patient scored 30/30 for the whole MMSE. The next one is Geriatric Depression Scale. We did it to detect any ineffective and behavioral symptoms of depression in our patient, but our patient did not show any signs of geriatric depression. Geriatric depression is also closely related to Erik Erikson's theory of aging. So another tool that we used to assess our patient was the Morse-4 scale. Our patient recorded a Morse-4 scale of 45/60. And because of her osteoarthritis and also the current medical diagnosis that she has. So the age-related changes that can increase the prevalence of fall among the elderly are poor eyesight, poor hearing, and also illnesses and physical conditions affecting strength, mobility, gait, and balance.
This is the diagnostic and imaging test. This is the complete blood count and coagulation test result, which are normal except for the high level of red cell count or RCC. High red cell count may be a symptom of a disease or disorder, although it doesn't always indicate a health problem. This is the liver function test, and this is the lipid profile, which the results are also normal. On 10 of January 2021, the patient underwent computerized tomography brain scan with the result of no focal parenchymal lesion and no intracranial hemorrhage. This is the pharmacological management. First things first, the patient was only prescribed with oral medications. Therefore, it is very important to know the patient's social history of taking alcohol regularly and if she has any liver problems. This is because oral medications have to go through first-pass metabolism in the liver before they can be contributed generally into the blood circulation in the body. By consuming oral medications and have liver problems may increase the risk of liver damage. The patient is prescribed with paracetamol or PCM, and it is very important to know if the patient is allergic to PCM or any other medications. Second medication is Losartan, which is an antihypertensive drug. The most common side effect of this drug is dizziness or lightheadedness and weakness. Therefore, it is very important to provide safety measures by placing 4 resign with the score obtained from Morse-4 scale, putting up the side rails and setting the bed to the lowest position to reduce the risk of fall, as this medication commonly causes lightheadedness or dizziness. And advise the patient to inform the nurses or physician if the side effects of the medication worsens. Thirdly, clopidogrel. Wow. Clopidogrel, or it is an antiplatelet. It is an oral medication. It is to treat recent stroke and reduce the risk of heart disease. It causes easy breathing or bleeding and stomach pain. Therefore, it is very important to check the lab result for liver function test and complete blood count. And advise the patient to use sharp objects with caution to avoid getting bruised or injured. Thirdly, aspirin, which is a non-steroidal inflammatory drug or NSAID. It is an oral medication. It is to relieve mild to moderate pain from conditions such as arthritis. This patient is diagnosed with osteoarthritis. Therefore, this medication is especially for osteoarthritis and to relieve pain. It causes upset stomach, feeling bloated, heartburn, and stomach bleeding. Therefore, it's very important to ensure that the patient has informed the physician regarding other health problems such as kidney disease, liver disease, diabetes, and gastrointestinal problems. And if the patient feels very discomfortable taking the medication on its own, it is advisable to take the medication with milk or food to reduce stomach upset. Fifth, pantoprazole. It is a proton pump inhibitor, which is to treat stomach ulcers, and advise the patient to inform the nurses or physician if the side effects of the medication worsen, and advise the patient to consult with the physician if there are any changes to the drug regime to avoid any dangerous possible drug interactions. Lastly, atorvastatin. It is a HMG-CoA reductase inhibitor or statins. It is used to decrease the production of cholesterol in the body. Despite the recommendation to take statins medication at night, as most cholesterol is synthesized when dietary intake is at its lowest, the half-life of atorvastatin is 14 hours. Therefore, the patient can take the medication at any time as prescribed by the physician.
For the nursing care plan, there are two prioritized nursing care. The first diagnosis is altered cerebral tissue perfusion related to temporary disruption in the blood supply to the cerebral associated with blood clot. The goal is for the patient to maintain stable neurological status throughout hospitalization, and the patient will have decreased risk to recur TIA or develop stroke. The nursing intervention for altered cerebral tissue perfusion are: first, assess and monitor neurological status to look for any evidence of stroke. It is assessed based on the level of consciousness, speech, and commands such as open eyes or closed eyes. Besides, the assessments of motor systems such as muscle power and muscle tone. Assessment of coordination also being done, such as Romberg's sign. Second, monitor the blood pressure reading. Continuous monitoring of blood pressure is crucial for preventing and predicting stroke. If there is fluctuation in blood pressure reading, it might be because of cerebral injury in the vasomotor area of the brain. Third, administer antihypertensive, Losartan, as prescribed by the doctor. A good control of hypertension may reduce the occurrence of ischemic stroke. Thus, Losartan is prescribed to the patient to control hypertension where it is able to dilate small blood vessels and leads to cardiac and renal protection. Lastly, administer antiplatelets as prescribed by the doctor. For this patient, doctor had prescribed double therapy, which is a combination of clopidogrel and aspirin. Clopidogrel acts synergistically with aspirin to reduce the incidence of stroke in the few next months. The evaluation is done. She maintained stable neurological status throughout hospitalization, and her condition is improving, and she did not develop stroke during hospitalization. The second diagnosis is risk for fall related to interrupted brain function due to temporary disruption in the blood supply to the cerebral, which is transient ischemic attack, and impaired physical mobility due to inflammation of the joints, which is osteoarthritis, as evidenced by Morse fall scale of 35. The goal is for the patient to be free from fall throughout hospitalization. The nursing intervention for risk for fall are: first, provide the sign for risk for fall to alert other healthcare workers to take note of the patient in case the patient wants to go to the bathroom. Second, ensure patient's personal items such as water bottle, call bell, and mobile phone are reachable by patient. Unreachable items make them walk, and it increases risk to fall. Third, provide safety measures by putting up the side rails and setting the bed to the lowest position. This is because bed rails provide a hand help to get in or out of the bed. Plus, it also reduces the risk of falling out of the bed when being transported. Besides, lowering the bed at the lowest point possible helps to promote patient's safety and reduce risk of fall. Lastly, identify drug interactions and side effects that can risk the patient's safety. The patient is given Losartan, and one of the side effects is dizziness. Patients may have difficulty walking due to imbalance caused by dizziness. The imbalance may cause fall and cause injury. Thus, the patient is advised to rest in bed if she feels dizzy after she takes Losartan. On evaluation, patient is free from fall throughout hospitalization.
Thank you, Fatin. Now, I'm going to talk about the health education that can be done on the patient. Since the patient has low to moderate risk of fall, she can be educated about fall prevention strategies that can be done at home. Firstly, she has to wear sensible shoes. She has to pick a fitting, sturdy shoes with non-slip soles. She has to avoid wearing high heels and flip-flop. She also cannot walk around with only using socks. Next is remove home hazard, which is the obstacle in walking path. Example of obstacle include boxes, electrical cords, plant stand, and coffee table. She can put non-slippery mat in bathroom and secure loosened rug with double tape. Beside that, she can light up her living space by installing night lamp in her house, so it will not be completely dark at night. She can make it a habit of turning on the light before going up or down the stairs. She can also put a flashlight at an easy-to-access area in case of power outage. Lastly, the usage of assistive device. She can opt to install raised toilet seat and grab bars for toileting and showering. She can also install handrails at both sides of her stairways at home. Aside from those strategies, she can also be educated regarding early warning signs of stroke. According to Beverly Hospital, the acronym to remember the sign is BFAST. By knowing the sign, the patient can be alert if it happens again in the future and seek for help immediately. Lastly, the patient have to make some lifestyle changes that includes diet changes, regular medical checkup, and exercise regularly. Based on Ted's theory of longevity, longevity and aging is determined by the accumulations of alterations in DNA, while single organ system theory states that aging is caused by unidentified breaking down of body system. Hence, to slow down the alterations and breaking down, the patient have to make some lifestyle changes. In conclusion, our patient Madam X had been admitted to medical through SGH due to transient ischemic attack, which also known as mini stroke. It is an acute episode of stroke which occurs within a few minutes to hours. Madam X has risk factors that cause her to get it, which is her existing medical problems such as hypertension, dyslipidemia, diabetes mellitus type 2, and angina pectoris. Her health education includes fall prevention strategy that can be done at home, whereby her home environment had been modified to reduce the risk of fall, education about early warning sign of stroke so she can be alert if it happens again and seek for immediate help in the future, and lastly, lifestyle changes as it reduces the risk of developing the disease again in the future. This is our references. That's all from us. Thank you.